10 a.m. or on YouTube, channel DZRJ 8:10 a.m. Radio Bandido.
The views and comments of the hosts and guests are not necessarily those of the station.
Hi, I'm Nicole Jacinto. Join us on Healthline with 𝗛𝗵𝗶 as we discuss the latest health and medical topics with doctors from 𝗛𝗵𝗶. For a healthier and uplifting lifestyle, tune into Healthline with 𝗛𝗵𝗶 on DZRJ 8:10 a.m. Radio Bandido TV. You've got questions, we've got answers.
Watch and listen to Healthline with 𝗛𝗵𝗶, Mondays, 5 p.m. to 6 p.m. Airing on Sky Cable Channel 224 and on all DTT boxes. Simulcasting online on Facebook and YouTube. Listen and watch on your mobile devices. Just search DZRJ Radio Bandido.
You're about to experience Healthline, a show where doctors from 𝗛𝗵𝗶 interact with you for a healthy, uplifting lifestyle. Moderated by Nicole Jacinto. You've got questions, we've got answers. So welcome to Healthline.
Hi, everybody, and welcome to Healthline with 𝗛𝗵𝗶. I'm your host, Nicole Jacinto. Today, with us on the show, we have Dr. 𝗛𝗛𝗵𝗶 Garcia Lantano. And Dr. Lantano is going to talk to us, discuss a very important topic. Now, this is more for those who are seniors, although it may affect younger people. And of course, for those who are watching who are the primary caregivers or the children or anyone who's concerned about their relatives. So this is I believe it's a really important show because it hits on two aspects. We're going to talk about anxiety and dementia today and how anxiety affects dementia. Good afternoon, doctor. Welcome to the show.
Yes, hello, good afternoon. I'm glad to be here.
Thank you. Thank you. This is such an interesting topic because we can talk about one thing or the other, but here we're talking about how one affects the other and how it can be interrelated. And I'm going to ask you a lot of questions. Okay. But before we start, doctor, can you just, as we start, can you just tell the audience or give me an overview, just a brief overview of what dementia is, so that we know what we're talking, we know more, what we're talking about when we start discussing how anxiety affects dementia.
Okay, dementia is a disorder of the brain which affects the person's memory. And then it also affects how they deal with the immediate environment. So we're not talking just about problems with memory here, but there's a bigger scope, which includes the behavior. The behavior may also change during the course of dementia. So I'm glad to be with you today regarding this topic.
Thank you, doctor. Okay. So dementia is it of course it's a disease or a condition that happens to our brains. And then can you just differentiate a little, because I know a lot of people mix up dementia and Alzheimer's. If you can just do that so that it's clearer to us, because we're here to learn from you and I'm very happy to have you as a guest and today and discuss dementia and anxiety.
Yeah, actually, dementia is a bigger umbrella of illnesses. There are many types of dementia. For example, there's Alzheimer's dementia, which we all are familiar with. There's also vascular dementia. This is the type of dementia that happens when one develops a stroke, for example, or the blood flow to the brain is compromised. There are many others, less common types of dementia like Lewy body dementia.
Okay, thank you, doctor. So dementia is it covers a bigger umbrella, and there's dementia associated with Alzheimer's. As you said that, a lot of people interchange the terms, and it's good that you're here that you differentiated it for us. And also, can I ask you, doctor, what is the biggest is there what you call it, a like what is the biggest I guess who gets affected by dementia the most?
Okay. A lot of people gets affected by dementia, but there are, for example, for vascular dementia, those with hypertension, uncontrolled hypertension, those with stroke,
Yeah.
those with diabetes. These are strong risk factors for dementia. And also women, as we advance in age, we also become prone to some conditions related to dementia.
Okay, I see. Thank you, doctor. Because there's also I believe so. Okay, if it's vascular dementia, and like I actually know someone who in her 40s had, I hope she's not watching right now. But anyway, I'm not naming her. She had like 4 strokes. So I mean that, and it can affect what I guess what I'm trying to get at is people think it's just something you get when you're older. But the demographics, usually, yes, it affects older people as we get older. You did mention women. We develop some conditions, or like women are probably more likely to get it than men. Is that because of menopause and the hormones, or
Yeah.
yeah?
There are some studies pointing to that.
Okay. All right. Thank you, doctor. But I guess I just wanted to kind of highlight that, somebody younger might also have it for other reasons. Because you mentioned like it could be because of other illnesses, and or due to stroke, or like, or vascular dementia. So this must also apply to a range of people, from not just one type of demographic, I guess. I mean, the demographic is also a bit bigger than you might think. That was the point I was trying to make. Okay, thank you for telling us what dementia is, doctor, and giving us the bigger umbrella term for that. And then, okay, doctor, can you tell us just, I guess, in clinical terms? I think everyone knows what anxiety is, but we might be overusing the word. Is there a clinical basis for anxiety? I mean, is there one, or do you just like clinically interview your patients and know that they're anxious? Because I can say I'm anxious, and I really am, but maybe it's just for the moment, right? Is this like anxiety that's really I guess if we were to talk about long term or even cyclical depression, anxiety, that it really does happen. Like, it's not just for the moment. Oh, I'm nervous. Oh, okay, you have dementia. You're nervous right now. Like, just kind of want to dispel that type of thing, that type of thinking, or maybe perhaps misunderstanding that some of us might have when we
Yes.
talk about anxiety and dementia. Is okay.
Yeah. So first,
Is it like a
anxiety, sorry, anxiety is a normal
oh, go ahead,
emotion
doc.
for everyone. So if we are in an uncertain environment or an unusual environment, it's
Mm.
just normal to feel anxious. So what differentiates anxiety being just an emotion to an anxiety being a disorder is that if it's a disorder,
Yes.
it impairs functioning already. So,
Okay.
siguro, the anxiety is very severe that the person cannot go to work or cannot go to
Yeah.
school. So, in the
Mhm.
case of dementia, especially as the disease progresses, the situation may become like unfamiliar to them. The house they used to live in may be unfamiliar. So, it's like a new experience for them all the time. So, that can cause anxiety.
Okay. Thank you, doctor. So basically, if I asked you like how do how does anxiety affect people with dementia? You've explained what dementia is. Like, it's not only a loss of memory or certain things, it affects your whole behavior and how you deal with your immediate surroundings all the time. So if a patient has dementia, they're already going through something where things can be unfamiliar, they don't remember, they could be repetitive, or and yeah, and things like that. And then as you talked about, I'm so glad that you differentiated anxiety as a normal, a normal feeling. But then if it's already like a condition that impairs function, that's also different. Because younger, uh, let's say younger people or people who have anxiety disorders, if it's already a disorder, sometimes they do get forgetful because they can't focus,
Yeah.
or they're too anxious. So um let's not say, oh my gosh, I might have dementia. You have an anxiety disorder if that's what your psychiatrist or your doctors tell you. But when it comes to the case of dementia, it's really intertwined, because let's say a person experiencing who has dementia, um what happens when they have, as you said, surroundings can already be unfamiliar. Does the dementia cause the anxiety, or could anxiety worsen the dementia in that sense? Like, if let's say it's not yet a a disorder, but how does anxiety affect people with dementia? Let's say it's just a feeling for now.
Yes. Okay. Aside from dementia being just a memory problem, we have what we call behavioral and psychological symptoms of dementia. So included here are depression, agitation, apathy, and of course, anxiety. So because of this, as you can see now, it's a bigger problem than just memory. So all those are interconnected. It's not just the anxiety may worsen dementia, but it's a part of it. It's part of the big package. So, for example, the unfamiliarity with the environment, as I mentioned earlier, diba, it can cause like the people with dementia being anxious because they don't know where they are. Sometimes they don't know the people who
Mhm.
are with them. If there's a new caregiver, they're unfamiliar with the caregiver. They might mistake them for a stranger who might do harm to them. That's
Yes.
why agitation happens. So these are interconnected behavioral systems or behavioral changes that happens in dementia.
Thank
So
you, Doc.
yeah.
Sorry, go ahead. Keep talking. You didn't mean to
Okay,
cut you.
please proceed. Yeah.
Okay. All right. So that's great. Now you outline, like, it's not just the loss of memory, but a behavioral thing. And it all comes together. When you have dementia, it comes together with depression. You mentioned depression, anxiety, also apathy. Like, it could mean like the person doesn't, they seem apathetic, like it seems like they don't care. But maybe because they're not exactly in the present with you, right? Because they're unfamiliar with their surroundings, or maybe they've forgotten who you are for that, for those few brief minutes that you see them. And it's sort of like they can be lost in their own world, no? For us, it's difficult for other people to reach them. And you mentioned the anxiety. Of course, somebody will, I mean, it comes with it, because it's like please jump in and correct me anytime if I'm wrong. I'm just trying
Sure.
to like recap what you said for our listeners out there. So to emphasize it, if you're already unfamiliar with your surroundings and you mentioned the caregiver, like the next day they might be, who are you? Or they might not even ask, right? But they
Mhm.
are anxious.
Yes.
They're afraid the person will do them harm because it's a stranger to them. Even some family members can, at times they won't exactly remember, or maybe someone that they only remember their family members, but not every single one, or every single friend, or every single person that that they've met, especially if they don't associate with them often. So I guess that's, so when you talk about dementia, you're saying anxiety and these other types of conditions come hand in hand with the behavioral aspect of dementia.
Yes.
Did I get it right? Okay, if
Yes.
we have quiz, Are you gonna give me like I just want
Actually, if I may, another scenario that happens in the very early part of dementia is that these people's memory are still, there may be changes, but they still can understand what's going on. So some of them may develop anxiety because they see the symptoms of dementia, the memory problems coming.
yeah,
Yeah.
that's true. So like that's why people will with dementia also start um getting anxiety or experiencing anxiety because they can see it happening to themselves.
Yes.
And they can how difficult, no? How
Yes,
painful
true.
how
Mhm.
painful my heart really goes out. How painful for people who have dementia and for the people who really truly care about them and love them. Um it's scary basically, no? So they get anxious and then if they've been, let's say, diagnosed and then they know that they have it, they start noticing that they forget things and then they start worrying,
Mhm.
and that's where the depression comes in too.
Yes, possibly.
Possibly, you start worrying, you start thinking, what will happen, and and it must also be difficult for those who truly and really love them, care for them. Okay, so that can start the cause of anxiety. People who notice that they're becoming forgetful or who may have already been diagnosed with dementia and they can feel their condition worsening. When you have dementia, doctor, I mean, I guess I have to ask you this: is there a cure for it?
Okay. At this point, there's no real cure for dementia. So, we only have medications to prevent the progression of the
Okay.
disease. But there are trials overseas now uh, on vaccines for dementia.
Really? Vaccines for dementia?
Yes. But
Amazing.
it's still in the research period.
Still in the research period. Okay. Wow. Okay. That's amazing, doctor. And that's a great new piece of information that you've heard here on Healthline with Makati Med. Thanks to to um to Dr. Alantano. May I call you doc? I feel like calling you doc. Say, I can't Dr. Anna Marie. No.
Anna,
Okay.
they
So
call me Anna.
Dr. Anna. Okay. So so that's really amazing and good to hear that at least there are studies and they're trying to move that way to prevent dementia. Okay, I know this is like a sort of just far out question because they're still in the trial stages. But if you get vaccinated against, it is just an what if, right? Because if you get vaccinated against dementia, I mean, vaccinated to prevent dementia, and it works, but you still get other illnesses like Alzheimer's, can it help?
Uh, well, it depends on the research actually.
Okay.
Maybe it can because this is still in the trial phase. But you see a glimmer of hope on vaccines is promising, di ba?
Yes, it is. It is. And doctor also, all right. Now I've spoken to a number of doctors, and since you're the expert on dementia and how anxiety affects it, let's get back to that in a minute. But just occurred to me, um, can the prevention of hearing loss prevent dementia? Is that an important factor for you, for someone who deals with people who have dementia all the time?
Okay. One thing that we try to address in a person with dementia already is to have consistent sensory stimulation. And
Okay.
being hard of hearing means there's less stimulation for that person.
Yeah.
So if there's hearing loss, definitely getting some hearing aids may help stimulate this person. For example, it's better for them to listen to the music. If
Mhm.
they have a favorite show on the radio or on TV, they can do that. And that's stimulating. They can watch that.
Mhm. Thank you, doctor. And also, I mean, people who have hearing loss and may not have dementia, they get left out of conversations. They feel isolated. there sometimes they get tired of saying, "What was that again?" And then you have people sometimes, like kind of shouting, "Ah," so they kind of get left out of conversations, which are also stimulating.
Mhm.
And the usual activities, and you're kind of just guessing words. I know a lot of people who, you would think they don't need a hearing aid. Like, I know a 50 something 53-year-old neurologist who is like really good, and he like shows his hearing aids, and he says, I have some hearing problems, and I care about my brain. Oh, he's a neurologist, and he's like, so don't be ashamed, and make sure you can hear well, you're part of the conversation, you get enough sleep, and all of that. And of course, he gives different advice for different types of conditions. But thank you for addressing my question on hearing loss. I think maybe many people take it for granted that we should just go on without, I don't want to wear a hearing aid, or maybe I'm too young to wear a hearing aid. But I do know people my age or younger who have been wearing hearing aids for a while. So, what was that? No, I'm just kidding.
Yeah.
I mean,
Actually, stimulation in a general sense is helpful in preventing dementia from progressing. For example, when we say stimulation, it's not just hearing, it's reading, it's learning something new. So all those help in preventing dementia. And there's an interesting study among the nuns. They
mhm.
call it the nun study of the sister schools of Notre Dame
Oh,
in the
okay.
States. So they studied the nuns, and then at the end of their lives, these nuns would donate their brains for study.
Okay.
So those nuns who continued to learn something new, even
Mhm.
if their brain showed dementia, clinic
Yes.
uh, on microscopic examination, the brains show dementia and the brains uh, would become smaller. They still did not show with symptoms of dementia upfront.
Okay.
Okay.
Stimulation. Okay.
Stimulation is very important. Reading, a lot of reading.
A lot of reading, yes, which we do less of nowadays. Uh, okay. Doctor. Okay, so can I ask you, since we're dealing with anxiety and dementia, a lot of brain stimulation, so reading, learning something new, how would you kind of manage the anxiety? Because I've heard, okay, I've heard two different, I used to read a lot, but I've heard two different, like, um sort of, it seems to be they seem to be opposite. So they say some people who have problems with, let's say, dementia or other things, or Alzheimer's, like, they should have a routine. But then I've also heard that you should break that pattern, I mean, every so often, because to learn something new or to do something new. How does anxiety now come into play when it comes to that? When it comes to someone with dementia trying to learn something new.
Okay. So predictability is very important even in people without dementia. For example, you have things lined up for the day, you go through the activities with ease. So in a person with a memory problem, having a built-in routine day in, day out is very important. It makes it easier for them. For example, after breakfast, I'll start reading the newspaper. After
Okay.
that, I'll take a bath. After that, I'll go meet some friends. So this becomes it becomes easier for them to go through the day
Okay.
because of familiarity.
Okay.
However, it does not mean that you only stick to the routine because you want them to also experience something new, especially in the earlier part of dementia. So put in some activities. Maybe talk to some friends, do one activity together.
Hmm.
Okay,
It
so
would
yeah.
Go ahead. Sorry, doctor. Go ahead. I didn't mean to
So
cut you.
we can put the two aspects that you mentioned together. Start a routine,
Okay.
but then try to put in something new. But for a person with dementia, don't push it too much, especially in the more advanced stages. So you have to also take it.
Yes. Because that'll Yes, okay. Thank you, doctor. I mean, that makes it a lot clearer to me, and I'll have fewer arguments with, I can now win the arguments with members of my family. Thank God none of us have been affected by dementia, but we often, sometimes we discuss medical things and like, at least, see, I can tell one of my sisters, see, I told you. No, okay. Anyway, thank you, doctor, for telling us how we can combine the two, which is learning something new and the stimulation which will help the brain and even those with dementia. And you said it's the nun study, the nuns of Notre Dame in the US. And
Yes.
then also the routine, how it helps. And Doc, can I ask you, like, okay, if somebody with dementia has a routine, does it also sort of, I mean, it would be hard to prove it, but do you think that in a way there's muscle memory? So I mean, it's less. I mean, because you're dealing with the brain, right, doctor? And and but in a way, if there's muscle memory in that, then and it's familiar, the more familiar it is, the less agitating it is. Is that the aspect that we're trying to get at? Like,
Actually, the more you get into the routine, the easier it will be, because doing something one after the other, if it's not planned, can also increase the cognitive load for the person. Okay, so but if there's a routine,
all
it's
right.
easier to follow through. And then it's also easier for caregivers to do
Yes,
all the activities.
yes.
So
Hindi
it's
yung
easier.
sabog na, today. Thank you, doctor. And then, by introducing things, like you did say earlier, you mentioned, for example, okay, I'll take a shower, I'll eat, no, no, you said I'll eat breakfast. Let's say the patient eats breakfast and they read the newspaper. That reading itself is learning, no?
Yes.
I mean, okay, so that's great. Okay, so there's one thing there that's actually that hits on like both the familiar routine thing and also they're learning. And then and they're reading. I mean, they're using, you said earlier in the show, to, I mean, to, I don't know how you said sensory, no? Parang try to get the senses going to
Yes.
stimulate the brain. So that's, and that would be all the senses, sight, um, being able to hear, feeling, um, taste, okay, and smell. Okay, now I'm forgetting my senses. Okay, all right. So doctor, and when you introduce something new, can you do it? Sorry, I'm being very particular so that because I got a lot of like questions already from friends. So I said, okay, then you'd better watch the show because your questions will be answered there. Um, let's say when it comes to like if you take them out once a week and then they get used to it, it's stimulating also. Is that okay?
Actually, it depends on the activity. For example, if you want to bring a person who is symptomatic to a mall, for example, that can be confusing.
Yeah,
Yeah,
it's too much.
especially if there are so many people.
Mhm.
That's confusing for them, but maybe bringing them to a small group with
Mhm.
friends, to a small group get together, may be
Yes.
helpful. They'll see people they're familiar with.
Yes. People they're familiar with, so that's also the key. And maybe, I mean, because of COVID also you have to you have to, and other illnesses out there, you have to watch out. I mean, maybe even having like you know um Zoom meetings with like their friends, if they once a week or twice a week, that kind of thing. And then as you said, I'm glad you cleared that up because taking someone out You also have to choose the place and the people. I mean, if it's a mall and it's really noisy, that's already irritating to someone who doesn't have dementia and is younger, and it can be more confusing for them. But if it's a smaller place, maybe a quiet restaurant, but there's still some differences, some learning, some flurry of activity that sparks their senses. Then, and especially you always mention like people, their friends, their family, people they're familiar with, then it could help.
Yeah.
Okay. Okay. Thank you, doctor. And like this is also to encourage caregivers and people who are in charge of taking care of older people. Let your moms and or whoever you're taking care of. For me, it's my mom, my yaya, whoever you're taking care of. Let them hang out too with their old friends. They were young ones too, barkada nila. That's why they have those meetings. Like when you're younger, you have the chance to go out and hang out. Maybe make more of an effort to plan things for them where they all meet up. And then they're all like, "Who are you? Who are you? Who are you?" But they'll get it. Okay, doctor. When it comes to a patient who has dementia, when can you tell that they're anxious? Are there any signs of what are the signs of anxiety in people who have dementia? Okay, because we know their behavior can be different, or they might be like scared of a person, or they might even lash out, right? So at somebody. But how can you tell if it's anxiety that's causing it? Are there kind of symptoms that would point to the direction that it's anxiety that's causing this
Sometimes
like behavior, right?
verbalize. Yeah. Sorry. Sometimes they can
Sorry.
verbalize. Sometimes they can verbalize
Okay.
that they're anxious, they're afraid. But then, outside, we can sense some uneasiness. They cannot keep still. They keep on moving around. Okay, that can happen too.
Yes. Okay. So you can sense some uneasiness, like they could be quiet but they're uneasy. So at that moment they could be anxious, especially if you're familiar with the person you're taking care of. So you always have to also be very sensitive to your patient. I'll just call it patient. I'll just call the person with dementia patient your patient's needs, whether you're a caregiver who's being hired by the family and you're also part of the family, or whether you are a family member, you can sense it. Parang they're not comfortable, or they're a bit uneasy, or okay. And then sometimes, as you said, they can verbalize it. That they say, "I'm nervous," or "It doesn't feel right,"
Yeah.
and they say, "I'm afraid."
Mhm.
How should you deal with them when? I mean, if they verbalize it and say, "I'm anxious," or "I'm nervous," or "I'm afraid." I mean, do you have strategies for that? Or even if like they don't verbalize it, do you have any strategies for that you could share with us? And I know it's different for every patient, but just basic stuff that you might have, tips.
So, for example, in the home, make the environment simple enough for the person with dementia to navigate it. Don't make very complicated setup.
Yes.
And also talk in a simple way.
Mhm. Yes.
Not a lot of confusing details muna. So we have to take it easy in explaining what's going on around them. And we also
Yes.
need to like introduce new people in the household. This is your new caregiver. Her name is like this.
Mhm.
Her name is Marie, for example.
Yes.
So that he or she
Mhm.
becomes familiar with this person, and never be impatient in repeating that over and over again.
Yes. Yes. Hey man, your parents weren't impatient with you when they repeated the stuff as you were really, really naughty. So don't be impatient with your elders as well, or people who have dementia. It's hard enough what they're going through. Um, And okay, so those are great strategies, doctor. And also, like, maybe if you understand them from their point of view, and if you're training or orienting the caregiver, maybe you can explain certain things, because sometimes there is a language gap, or even simple things like between someone who speaks Tagalog and somebody who speaks another language. They might use words that are not, as you said, use simple words or words that they understand.
Mhm.
Like, if you know their behavior, or if they say this, okay, it's this, because you get to know someone throughout the years, and or throughout in time, you get to know someone, you get to know what words they use. Like, when they say this, they mean this. So thank you, doctor, for telling us those strategies. And then, doctor, how can how does anxiety make dementia worse? Can it make it
Okay.
worse? I mean, like, clinically, or just the behavioral part? How does it make it worse?
Okay. It can make it worse in a way. For example, the anxiety is not managed, or the confusion about the environment continues. Some patients do get really agitated, and some of them can get violent. So it needs to be addressed early on.
Mhm.
Um, Actually, we would recommend early treatment. Of
Mhm.
course, before early treatment, recognition, diagnosis, and early intervention of dementia to slow down the progression so that
Okay.
we can do something about it.
Yes.
And I may mention also, uh, there's a free intervention that's available for all of us. The sun. It helps with orientation. It
Uh-huh.
gives us the routine, and it improves the body clock. In a person with dementia, the body clock sometimes gets disrupted. So the
Yeah.
sunlight and natural light is a
Mhm.
very important part of management also.
So getting some sun, of course. Um, what's the best time to get sun? Between 8 and
Seven,
7 to
even
9.
earlier, yes.
Okay, 7 to 9, and then in the afternoon also, if you can. Even, I mean, okay, it's a rainy season now, but when you can, you get some sunlight, so that helps. Getting sunlight, we hear a lot. I mean, a lot of our conditions, whether it's dementia or others, can be addressed by getting sunlight. Okay, what if the patient was a night person or a night owl, and their body clock is really like, attuned to sleeping in the morning? Can they just get sunlight in the afternoon? Like, should you try to change their body clock, or since they were always kind of a night owl? I know people who are older, and like, they've always been night owls, sort of. So
Okay, but in general, in the management of dementia, we adjust the body clock.
you adjust the body clock. Okay.
Because if they're awake at night, everybody's sleeping, we're in for some difficulties. That's when agitation happens. Early in the morning, late at night.
And I mean, you have fewer people to interact with
Yes, I
if
agree.
everyone else is sleeping, right? I mean, okay. Maybe that's why I get anxiety sometimes. Okay, no, that's just anxiety anyway. But thank you, doctor. So you do, when you manage dementia, you do also adjust the body clock. Doesn't matter if they were night owls before. You do adjust it so that to lessen also the agitation and anxiety, and you kind of introduce that routine, and it helps with anxiety. The sun, as you said, it helps your body clock. It seems to help with everything, no? So at least here, I mean, even if it's hot, well, at least you've got the sun. You complain about it, at least you've got some sunlight. So it must be difficult for those people who live um, like very far up north during the winter months, when there's like no sunlight really for 6 months. It must be lonely. Or we know about I mean, I know about the depressions they experience. It must be more difficult for them to manage anxiety related to dementia as well. Okay, doctor. You mentioned earlier that, you know, uh, even in the early stages, anxiety can happen. No, I mean, the patient can start experiencing anxiety. Yeah. How the does it? Is there a sort of time when it really comes though? Like for most patients, or you said it can start in the beginning, but is there a time when during the progression of dementia that anxiety really hits?
Yeah, it becomes prominent actually in the moderate stages. It becomes more prominent.
Okay. So um, the earlier we recognize anxiety, then the earlier you can also help the person with dementia deal with anxiety as it becomes more prominent. Like, don't wait for it to get prominent in the moderate stage. Start dealing with the anxiety already. And as you said, you can slow the progression of dementia. So hopefully can you slow it down enough to, never mind, it's about anxiety dementia. I'm like, I just, would you come back on and talk about dementia and other topics, doctor? Would you come back to the show? I like, I have such a, I mean, I know I'm going all over the charts, but I mean, just talking to you, like, I'm not even reading the questions. I can't, I mean, just having a conversation with you is great, you know? So I'm sure there's so many other things that you could talk about that would really help. I'd really like the show to be a platform um, for for people to learn more and understand, and maybe we can reach some people and actually help them or comfort them in some way. Okay, doctor. When somebody, so you did mention early stages and it becomes more prominent in the middle. Um, can you treat anxiety in someone with dementia? Like, how do you usually treat it? Is it addressed with medication as well? In some instances, can you?
Mhm. So what's important here is to treat dementia itself,
Okay.
because there are some medications that we can give to relieve the anxiety to a person without dementia. But
Yeah.
then they're restricted in dementia. We cannot use them. We should not, because it worsens the disorientation. For
Okay.
example, we would give um, relaxants like clonazepam to a person with anxiety but without dementia. But we cannot just give that to person with dementia because it can cause disorientation.
Yes. So you mentioned clonazepam. Okay, so like benzodiazepines in general.
Yes.
Okay, so anti-anxiety medication. So there's clonazepam, there's alprazolam, there's diazepam. Any of those, if somebody does not have dementia, you can give it to treat the anxiety. But when someone has dementia, it can make the disorientation that's already present when someone has dementia worse. So you have to deal with it in a you can't deal with it with medication. It has to be dealt with through dealing with the person, connecting with them through how you manage.
It can
Mhm.
be treated using the usual medications for dementia. We have memantine,
Oh,
mepicil. So when we treat that, and of course the cognition improves a little, maybe they can deal with their environment in a better way.
yes,
So
yes.
treat the
And
dementia.
treat the dementia, and that's how you treat the anxiety that comes with the dementia. Okay. And also, as you said, no, like, speak in a simpler manner, um have their routines, but also introduce something new, some learning, stimulate their senses, and like maybe, you know organize stuff for them and clean up the house, because if everything is here and there, is it, maybe they weren't obsessive compulsive about mess when they were younger, but it really helps when you can just clear and see. I don't know if that, maybe that's only for people who already have OCD and then they have dementia. But thank you, doctor, for answering that question, because um, some people may, so just, give the person some anti-anxiety medication. But in dementia, you're saying treat the dementia to treat the anxiety. I mean, when someone has dementia, then treat the dementia to treat the anxiety. Are there, so is that the kind of therapy or treatment that you would provide? You mentioned giving like memantine and other medications for dementia. Are there other ways also that you specifically, or that you've seen, like practices of how to treat people who have, like, let's say, bad anxiety or just anxiety in general and dementia? Are there other type of interventions or treatments?
Mhm. Yeah. So we mentioned earlier about the environment, the changes in the environment that we can use, like simplifying, like that. Uh, in general, that would be it. But
Mhm.
work closely with your doctors, with the
Yes.
neurologist and the psychiatrist. Work closely, because sometimes it's also easier for us. She cannot sleep. Let's give diphenhydramine. When we cannot, it worsens the symptoms.
Okay, yeah. Sometimes, yeah, diphenhydramine. So I'm just gonna say the brand name, Benadryl. Antihistamines, right? Some people just take them to sleep. No, it worsens the symptoms. So not for people with dementia. So work closely with your doctor, and maybe there are activities that um that the person with dementia likes, or liked before and still likes now. Maybe not very complicated activities, but maybe things they enjoy doing. And so that's why you're saying work closely with your doctor. Do you find that you also work, that people who have dementia also, do they consult psychiatrists often, or maybe their family members do? I mean, is that part of it, or not all the time? It's just really the
Well, it's not all the time, but if it gets really hard for them, they can always consult a professional. But what's important for dementia care is the caregiver needs some time off, because it's
yes.
hard to take care of a person whom you love and showing signs of dementia. So it's important to take time off, get a breather. Maybe uh, some other family member can supplement the care for a while, because the person also needs to rest.
Mhm.
I mean, the primary caregiver needs to rest. So we cannot pour from an empty
Yes.
cup. So
Okay.
we need that sustenance, that time.
Yeah, people keep telling me that, and I've been pouring from an empty cup, but not because of that, just for other reasons. But you're right. See, doctor has said it again. A doctor has said it again. You cannot pour from an empty cup. So I guess that question was more for, like, also those who take care of those with dementia. Maybe you can take some time off, or if you feel, depressed or whatever, it's understandable. Okay to see a, a mental health specialist or professional. Doctor, okay, so you've answered how anxiety can be treated with dementia, which is to treat the dementia and also simplify the environment and make it better. And also, maybe the one taking care of the person with dementia, they don't, like, start reacting to the agitation. It will just, your 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 mood also affects their mood, so that could help. Like, if you walk in there all nervous, then even us, right? If I make you nervous right now, you would be, I mean, it might affect you, and you might get a little nervous. If I go, oh my gosh, doctor, blah 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 blah, blah, and freak you out during the show, you might start getting a bit nervous. Well, maybe not you, but other people would. Okay, so doctor, thank you. Are there any lifestyle changes that can that can help? You already talked to us about how they can help with the anxiety. Like, are there any others, like apart from getting sunlight, you manage part of treating dementia? It's really, it's actually really treating the dementia, no? Um, what about, is there anything like, is nutrition? Does nutrition come into play with dementia?
Yes, of course, it's a part of the general care in dementia. The person should have enough nutrients for the brain as well and for the entire body.
So, like, of course, you would want them to have a balanced diet, ideally, or um, maybe consult even a nutritionist or something like that if there are other things going on as well. And can okay, let's say someone has dementia and they have anxiety, and the anxiety is bad. Can it lead to other health problems aside from dementia in the person? Like, would there be behaviors that they'll do, or just things that could it? How could it make things even worse
Yeah,
physically for?
yeah. In the more severe cases, once they get anxious, they can also get agitated because sometimes it follows. If you're anxious, you cannot understand what's going on. Some of them can easily react, maybe with anger, maybe with some disruptive behavior. What's important is to prevent that from happening rather than just not managing it and just allowing the symptoms to progress. And sadly, it can end with violence coming from the part of the patient because they cannot understand everything. Just gets confusing.
And doctor, thank you, for saying that, because sometimes I find a lot of people to be just dismissive. Hindi, may dementia kasi yan eh. So, hayaan mo na lang.
Mhm.
Sometimes there's this attitude with different illnesses and diseases. Kasi ganyan yan. So, hayaan mo na lang. But manage it, try to help manage it, try to control it. Are there, can something also happen, like for example the patient had dementia but didn't have let's say hypertension before, but the way they deal with their anxiety is by wanting to eat more or getting angry, or like they get agitated and angry often? Like, could they develop hypertension or something like that? Is that possible?
Well, when one is anxious, the blood pressure can
Well, it's
increase.
possible, but is it probable?
But it's just a part of the reaction. Because naturally, when we're anxious, the blood pressure and the heart rate increases.
Yes. Okay. So we don't also want to, like, always, bring let like that's why I don't like it when people are very just kind of dismissive. Oh, sige, hayaan mo lang, let them go. Kasi every time we get agitated or someone gets agitated, especially if they're older, as you said, the heart rate goes up, and it's not really a good thing to be on a seesaw with your emotions or your blood pressure. Um,
And also,
are
Nicole,
there
being in a supportive environment is very good for a person with dementia. For example, if the patient is in an environment that's chaotic, the more symptomatic they can become.
yes.
It becomes more confused.
So those are like triggers. Yeah. Those are like triggers, doctor. Like, I mean, you already mentioned some of the triggers, but as you were saying, chaotic environments that, can you maybe give us some examples of what, as a doctor who specializes in this, it would be a chaotic environment for a person with dementia, and it would trigger the anxiety?
Yeah, for example, in a household where there's a lot of shouting, for example, they can get agitated as compared to an environment where people would talk to them nicely and
Yeah.
explain what's going on.
Yes.
So, caring for a person with dementia takes a lot of patience. And I must say, a lot of love too.
Yes. Yes. And also, doctor, I mean, just typical things where, like, don't, like the stuff that we're told, like, if you don't need to shout within house, like, even if it's just a normal thing you're asking for, or you're like, oh, ganyan. Like sometimes there's a lot of noise, or, just, I mean, you can kind of take it, control it a bit, like, you play loud music at the same time, then somebody else watches TV, then the two people start fighting about something, and then there's a lot of, did you get to this? Did you get to that? So that could be also considered a chaotic environment, like just the shouting and sort of this very kind of kinetic, hyper vibe can affect them. And also, I really get angry at people who shout at older people and sick people. I really it like I'm like, do not raise your voice, And there's a way of talking louder without shouting. With still they will get that you can still have that tone where there is respect. As you can see, my tone has changed now to one of anger. Just thinking of people shouting at older people or sick people. Okay, um, doctor, like so you told us already, being in a chaotic environment can worsen the anxiety and dementia, and is anxiety a common thing, or is think that does it come with all types of dementia? Because you said it's an umbrella term, so does it usually come with all types of dementia, or just are there more? Is it more prominent in certain types
Yeah.
of dementia?
It can happen in any type of dementia.
Mhm. Okay, so any type of dementia. I mean, okay. So doctor, you've already told us what family members can do to, for their loved one not to feel so nervous or be anxious. And then, can you tell us, maybe you did mention about caregivers, like taking care of their own stress. Can you maybe tell us a little bit, or addressing their own stress when dealing with those who have dementia? Can you maybe tell us just a little more about that? Like, you advise to take a break. Uh, Anything else? Any words you have for those people who take care of those with dementia that apply to them, and as well as those who have dementia?
Yeah. Of course, taking care of someone is a dedication. We have to say that. But then, it's also important for the caregivers to recognize that they can get tired, they can get exhausted, and that should not make them feel guilty.
Mhm. Okay.
So, yeah, so they need some time. They need to have, for example, within the day, maybe an hour or two for an activity that they like, so that they can refresh.
Thank you, doctor. There's also, like, because we have like different types of, I guess, systems. Like, there's caregivers, and then there's shifting if it's a 24-hour situation for different types of illnesses anyway, and for older people. And but it's also a team effort. Like, there's someone in the family who can't do all the physical stuff, but can also take care of, maybe the medical stuff, the appointments, while also working. Like, so even that person is considered the caregiver. So that person can also take an hour off every day to do something. The emotions are there, the care is there, the love is there, the pain is there, and then dealing with, yeah, you also do get tired, and you shouldn't feel guilty. And it's okay to do something you like for 1 hour.